Hi, my name is Yasser Said. I will be talking about monitoring of hemodynamics and the vital signs at the bedside. We have multiple ways of reporting vital signs at the bedside. The usual way, which is I believe the least helpful, to report the vital signs on regular intervals. But I will present now with the monitor on at the bedside how to report the vital signs in more objective way and how to get reasonable pathophysiologic information from the vital signs. So number one, vital signs as histograms. So if you have the monitor in front of you and you have at the bottom here the selection buttons, select histograms, you will get by default the first histogram as oxygen histogram. The whole oxygen histogram, you have 5 bars, and each bar is representing the percent of time over the last 24 hours with interval of saturation. So you have the first one, 95 to 100, and then 90 to 95, 85 to 90, 80 to 85, and then less than 80. That's over 24 hours. You have on top here, and you can actually change the time to select starting from 30 minutes or 1 hour. So you can get the histogram over the last 1 hour and to compare that to the 24 hours. So you can get an idea about the improvement or worsening of the clinical case in relation to oxygen histograms. You can select other histograms. So go to data source, and you have trend data. You can start with heart rate. To get the numbers, touch the screen again, and you have multiple bars, and on each bar there is a percent of time over the last 1 hour, and you can change that to be 24 hours again. So you have the histogram for heart rate for last 24 hours, and you can get an idea if there is any shift to the left with bradycardia or shift to the right with tachycardia. You can also select perfusion index, which is a little number on the right side of the screen here. It is normal acceptable number between 0.4 up to 3. So you have the histogram within the acceptable range between 0.6 up to 2.4, which is really acceptable. Also you can change the interval to be 1 hour and go back to 24 hours. You can go to blood pressure trend. So this infant on arterial line. So you can select systolic, diastolic, and mean in different histograms. So you have the histogram for systolic blood pressure, arterial blood pressure, systolic over 24 hours. And it's collecting one recorded number every 5 minutes. And that's a cumulative histogram for last 24 hours. You have the histogram here exceeding the upper limit. So you can change the range and make the upper limit higher than what's on the screen. So make it maybe 90 millimeter mercury, and then you can get the histogram beautiful in the middle of the screen. You can do the same for the diastolic blood pressure and mean blood pressure. So you can get an idea about the trend of the blood pressure for the last 24 hours. What was the lowest blood pressure, and if the lowest blood pressure above the acceptable, then you have your infant in a stable condition regarding the blood pressure. You can check also respiratory rate histogram for the last 24 hours, and if you have the respiratory rate above, for example, 70 per minute, then you have infant tachypneic, and you can check if he's improving or not. You can select the last 8 hours and compare it to last 24 hours and get an idea about if he's improving or worsening regarding tachypnea, for example. So that's regarding histograms. Thank you very much. We are done with the part 1. Hi everyone. This presentation is a demonstration on cardiovascular and respiratory monitoring and the related interpretations. Monitoring hemodynamics and vital signs can be reported in different ways. The most common way is reporting vital signs on regular intervals, like the bedside nurse report all of the vital signs every 30 minutes or every 1 hour on regular intervals. That's the most widely used method of monitoring at the bedside, and actually it is the least helpful. But vital signs can be reported in other different ways, and these ways can be much more helpful for interpretation in a physiologic and pathophysiologic interpretation, and can help in early prediction of any deterioration, either the hemodynamics or the respiratory status. Number one, reporting vital signs as histograms. And this will be the first part of the presentation. And particularly blood pressure histograms are very helpful to guide early weaning of cardiovascular medications. Reporting vital signs as trends and also blood pressure trends can be very helpful to guide pathophysiologic, targeted logical treatment and selection of appropriate cardiovascular medication, and also early weaning. Impact of ventilation on breath waveforms, and this method also can detect hypovolemia in an easy way and can be done at any time at the bedside. Evaluation of arterial pressure waveforms. And then number 6, how to interpret near-infrared spectroscopy readings. Number 7, how to report vital signs as trends integrated with near-infrared spectroscopy. So we'll start with part 1, vital signs histograms. Reporting vital signs as histograms. Steps can be done easily at the bedside. First, you can touch the screen on histogram button, and then by default you will get oxygen histogram will appear first, and you may change the period of time that you need to assess by histograms. It can be 24 hours by default, but you can change that to 1 hour, 2 hours, 4 or 8 hours. And then touch data source to select other vital histograms. And you can select heart rate, perfusion index, systolic, diastolic, mean blood pressure, respiratory rate. Also, you can choose cerebral oxygen saturation if you have near-infrared spectroscopy machine connected. And also you can evaluate histograms for end-tidal CO2. All histograms bars should be included in the middle of the screen. If it is exceeding the margin, then touch select range. So you have the selection button range, and you can adjust upper and lower limits if any one of them exceeding the edge of the X scale. Here you can see the heart rate, respiratory rate, perfusion index, and blood pressure histograms. And for a stable infant, we should see all of the histograms for all of these parameters the same shape like normal distribution curve. That's actually reflecting the nervous baroreceptor, chemoreceptor, and the humoral factors, and all of these factors affecting the vital signs. So you have the shape of the normal distribution curve for all of the vital signs, excluding oxygen histogram. Oxygen histogram is different.
Here you have also the end tidal CO2, and you can see here the end tidal CO2 histogram for a period of 24 hours, reflecting that for 24 hours the CO2 was between 36 at the lowest level up to 53. I have case scenario just to show the value of evaluating histograms on daily basis. You have a baby boy born at 29 weeks, post-nurseral age of 34 weeks, and was stable on CPAP. Overnight, he became irritable and started to require more oxygen, and was given multiple doses of coronary hydrate because of the irritability. CPAP increased from 6 to 7. But in the morning, when we evaluated the histograms, we found that very wide base histogram for respiratory rate. So the infant was anyway between very periodic breathing, between very low respiratory rate up to very tachypnic, up to 120 sometimes. Very wide base of perfusion index. Perfusion index can be acceptable between 0.4 up to 3. You have here the very wide base and exceeding the upper expected normal limit. Heart rate also very wide base. And oxygen histogram. This infant was on oxygen, and you have a very unstable oxygen histogram. So you have the period of considered as desaturation less than 85%. You have 9% plus 10, 19% of the time, and each 1% reflecting 15 minutes below 85%. So we did septic workup, and the septic workup showed Staph aureus infection, and then showed clinical picture of pneumonia. This infant was started after that on mechanical ventilation, high frequency ventilation, and few days after improvement, you can see the improvement on the pattern of the histograms. Respiratory rate, perfusion index, heart rate, and oxygen histogram. That's actually after weaning back to CPAP. We finished with part 1.